voice looks worse than speed.
That's it.
Yeah, I mean,
Thanks. Probably true.
All right, so we are live. It is Friday, March 22nd. Wow. And this is the Senate Health and Welfare Committee meeting. So we're looking at two fiscal notes with Joint Fiscal Officer Owen Reinville. We're starting out with H 847. Nolan.
Okay. For the record, Noel Langwell, the Joint Fiscal Office.
Do we have these?
Should. Yeah.
Yeah, okay, so TTO.
Um,
Can we put it up? Can Kiki, you put it up on the screen?
or I can put it up.
Yeah, okay, well, no one will put it up, that would be good.
Give me a second to log in.
Then you've got no control over it.
Yeah, it's fine. Every committee is different. Some want.
Well, I just think that until we have a final bill in here, it might not help to print out more trees.
Some software.
H 47 is the peer support provider and recovery support specialist certification. We looked at it the other day.
I'm trying to get loose.
Are we on
Yes, we are.
All right, just.
We're just gonna get the fiscal note up for H 847 and then we'll be able to move along.
Yes.
And I will say for folks who might be looking in, today's probably not the day we have the most folks looking in, but it is the end of crossover and people are
Oh.
now trying to refresh and regroup and move forward with House bills.
It's not showing. I just opened it. Yeah, it's-
You-
Okay.
Do you want Kiki to put it up?
No.
Okay.
Just had to.
All right, there. Any a little bigger?
Page 72.
All right, that's H 72. Do you want to do that one?
Oh, no. No, wrong
We
one.
did that yesterday.
Do 47 first. Sorry about that.
All right. She's got a little fun.
At least I'm ready for the next one, right? Do you want me to just do back to back while I'm here?
Yeah, if you have the time to do both of them together, that will
That would be great.
solve a lot of problems for you.
Make my life.
Yeah.
Let's just take 1 second. Sorry, my apologies for all this. All right, third time to charm, right?
Yeah.
Okay, so, have you had a walkthrough of this, I assume?
Yes, we did.
Okay.
Yeah, so,
So I'm assuming you've heard what peer support providers and recovery specialists are.
Yeah.
When I was trying to do the fiscal note, took me a little bit of time to figure out how many people fit those categories. And the estimates we have are, that it's probably about at least 169 peer support providers that we know are currently employed at designated agencies and peer-run entities. And then, according to the health department, there are about 116 certified recovery support specialists working in recovery centers. So that's the number we're working off of. We estimate that the revenue from fees would be probably somewhere between $10,000 and $20,000. That would be fiscal year 26. And the revenues would probably increase in the future because it's likely that more and more people will be trained which I think we heard testimony from the health department that demand is there. So as more people become trained and enter the profession, the more money we'll collect fees. The initial fee will be $75, and that will, actually, the initial fee, I think, to start is $50. And then it goes up to 75, July 1, 2027. Normally, the licensure fees, the certification are around 115, and they lowered it because they wanted to make it a little more accessible. So they'll go to, they
For the
start off,
first, yeah,
yeah, it'll start at 50 and then it'll go up to 2027. So it's estimated it'll be about 10 to 20,000 in fees to begin with, and it'll go up over time. And then, as you've heard me say over and over again, with OPR, they estimate the implementation of this will be about 25 grand. So,
so almost covering,
over time,
yeah,
it's like they gotta front it and pay it back
right.
over time,
So
so.
it's like investing first and you receive a return later, maybe.
I meant, actually, what I'm gonna do, I'm gonna show you something real quick. If you want, I can show you the spreadsheet that I forgot to bring. It shows you the tracking of all the different OPR bills, like this, can you put it on the screen?
Oh, good. That,
And I can,
but look, it's okay. What we'll do is, I know that Tuesday is gonna be problematic because we have a joint, session at 10:30. But maybe there's a way we can get that, and
we can come back in,
yeah,
and we can have a big, just a more general discussion.
good.
Just to give you a heads up, I mean, it's a finance.
Yeah.
And appropriations concern, but
It's okay. We
you
should
can make
know that.
recommendations.
Because what we'll be doing is when we go through the budget, we'll have AHS and we'll look at all of the things that we've sent out with money and then the other things that might require support, and we'll do some prioritizing, and this is one of them. I think it's important for us to look at.
Yeah, and again, didn't have it in front of me. But last I looked, there were two pieces around the OPR, not to beat that horn. One was the estimated loss of revenue from all those bills, and the other one was the one-time costs. And I don't remember off the top of my head, but I believe the one-time costs for all the bills in both the House and Senate that are moving was somewhere around $67,000 in needed one-time costs, and that was peer support, that was some of the compacts, and it might have also been tools, if I recall. Again, I don't have it in front of me, but I'm happy to come in and walk you through the sheet, and then you can see doing pieces of
Okay.
stuff that happened last year and this year, and so we can just put
We'll
that on our
get you
agenda.
on. It might not happen till Friday next week.
Sure. I should have more time to read this, although I think there's gonna be a lot of floor time next week,
I know that. I know that.
so
We're gonna get it all done today, so
love it.
it should be fine.
Oh, and Lauren is here. That's good.
Did you
Okay.
wanna do Lauren? I can just come back.
No,
Want to do that? Because she's here, don't wanna waste her time, and I can come back and do 72? Or do you wanna do? what's
so
better?
Lauren, can you stay here for a little bit while, Nolan goes through another fiscal note with us, or why don't you chime in right now? Do you have any comments to make about the fiscal note?
Not on the fiscal note. I have more to say about about peer support, just a little bit to say about peer support. I have testimony elsewhere at 9:45, but I can stay here until then.
Okay, that's good. All right.
Alright, so. Maybe, whatever you'd like to do, Madam Chair, would you like me to do 72, or would you like to hear from Lauren?
Lauren, why don't you go ahead and then, what is your time frame?
I'll come back in 15 minutes.
Perfect.
That sound good?
Good.
Okay.
Good little exercise.
Okay.
Thank you all, Lauren Lehman, OPRGC, for the record. Thank you for having me this morning, and again, your patience with me appearing remotely. We have student-teacher conferences in Chittenden County today, so I'm running
Oh,
between
good.
schools. So I appreciate really taking the time to have me here to talk about peer support. As you know, I think you'll hear, you may have heard yesterday, there's really two structures here. There's one for mental health peer support providers and one for peer recovery specialists, support specialists. There was some discussion in the House about whether that second tier, the recovery specialist, would be peer or not. And I think there's an agreement at this point that it will be peer. The Department of Health will bring you that language at some point. So the structure really is that these individuals have lived experience in either a mental health situation or in a substance use disorder recovery situation, and they help guide and accompany people who are experiencing acute illness or acute situations recover from that space. This is something that's recognized in 48 states for Medicaid reimbursement. As a necessary precursor to that Medicaid reimbursement, there needs to be a state certification, and that's where OPR comes in. So we have been working and participating with the group that has been through the Department of Mental Health, that has been working with the peer support initiative to develop a certification program, the training, etc. OPR really comes in once the individual does the approved training through the Department of Health or the approved training through the Department of Mental Health. We look at that training. We would, under this bill, we would look at that training, say, you've completed the training, you're 18 years old. If there's a criminal background check, you've done that. And then from there, we issue a certification, and that person can then hold themselves out to the public as certified to provide peer support services or peer recovery support services. The agency, the underlying agency, will be more responsible for the policy. So Department of Mental Health working with the peer support specialists or providers, and the Department of Health working with the peer recovery folks. And so that is, and then OPR would step in as the credentialing agency. And we would collaborate with the Department of Mental Health and Department of Health to establish those rules for those programs. So it does have a cost to us. Again, you know, we're asking for an initial, as Nolan just said, an initial 25,000. That's to help us write the rules, to have staff time to build the application, to update our system. So that all those have an initial cost. Once the program is in full force, because this is not a very high income driver profession, we're trying to make sure that the costs of the fees for licensure are reasonable. Of course, that might mean that it doesn't actually cover the cost of the whole program. So right now it's $50 for initial licensure and $50 at renewal under the current bill. And then also under the current bill in 2027, the initial licensure fee will go up to $75. But renewal will still be at 50. So there's kind of a slow increase built into the bill. But it still probably won't cover all the costs of administering the program. But I think, again, it's such a worthy policy opportunity, and it'll bring opportunity for the state to bring in matching funds through Medicaid. So for the program.
Okay, thank you. That's very helpful. Do we have this in writing?
You do.
Yeah, so, okay, good. So this really sets the framework for us and gives us what we need to look at as we go through the bill.
Yeah.
And then we'll be hearing from folks both in the mental health and the substance use disorder recovery world, so we'll be able to understand the recommendations.
Certainly. Also included in the testimony that I submitted is a kind of discussion of the background check. There was some concern in the House about the background check, especially for individuals who might who have lived experience, who might have a criminal history, and how OPR deals with that. There's a provision in the bill that gives OPR the authority to conduct a background check, but it doesn't require OPR to do a background check. And the reason we did that is because the qualifications in the bill to become a peer support specialist or provider or a peer recovery support specialist is one of which is criminal background check or registry history as determined by rule. So that the rules could come out to say no criminal background check or minimal or whatever, or they could say we want a full FBI background check. And if they say the latter, OPR can't do those background checks without the authority that's granted in the bill. So
Got it.
it's
Okay.
kind of a preliminary option just to set the framework in case that's what the stakeholders decide they want.
So maybe how currently are, you do background checks for some of your professions at this point?
Yeah, we don't, not a lot. I think we only do the compact professions. I think we only do 5 or 6 at this point.
Okay.
I don't think the state, in our experience, the state doesn't really have the resources to do a huge number of professionals. We've had a significant backlogs when, for example, we did all the nurses and there was we created provisional licenses to help get people into work while those background checks went through. So, I think it's really a discussion with the peer support community to determine what their needs are in terms of having FBI background checks or just asking like we do now for all our professions, do you have a criminal history? And if so, can you explain it to us? So those are the options.
Okay. All right, any questions, committee, for Lauren Lehman? This is really very helpful and so as we go through the bill, of course, we'll look for your expertise and insight on all of this.
Happy to participate. Thanks for having me.
All right. Okay. Thank you.
Thanks all.
Okay. So we'll move on. Unless there are other questions or comments. We'll have Nolan come back and we'll look at the H-72 fiscal note. That was a good fit up for us, Bill. When we went through it the other day, it wasn't exactly completely and totally clear,
And I went upstairs and they were done, so. Oh, can you give me screen sharing again? Sorry, I hit record because I went to do it and moved right when I was doing it, and like.
I don't know if that happens.
Thanks for sharing fiscal notes today. This should also be on your website.
one more.
More.
Yeah, we have. Oh, that's right. Thank you.
Okay. So the bill has several.
Your name is.
Again, oh yes, record online, what we go to this law, because just my official title is Principal Fiscal Officer.
Yes.
Whoa.
So this bill has several provisions around harm reduction and criminal justice. I would just focus on the 3 things in this bill that have fiscal impact. So one is the manufacturer fee and evidence-based education advertising fund. This is an issue brief. I have an issue brief on this on the side. This is the one I sent for several weeks. I can send it to Kiki.
Right, I think we have it, but if you send it to Kiki and we'll have it up for this bill, it'd be great.
Yeah, so I'll send it to Kiki. I have it all queued up too in case you want to get it.
Perfect, thank you.
So what this bill does, maybe I'll talk quickly about what it is.
Sure.
So I have a little description of it.
Yeah.
The evidence-based, actually, what I'm gonna do really quick, I'm going to share a different screen. Let's do it quick since I know you have time now. Right, I'm gonna do a really quick explanation of the evidence-based fund. Okay, so this is the issue brief that I will send to Kiki. But basically, the prescription drug manufacturing fee and evidence-based education and advertising fund. So the prescription drug manufacturer fee is a fee of 1.75% of the previous calendar year's prescription drug spending by the Department of Vermont Health Access. And that money, so it's of that particular chunk of money, it's 1.75% of that. And it is put into a special fund called the Evidence-Based Advertising Fund, and it's in statute, and money from that fund can be used for specific things that are relative to that's germane to prescription drugs, right? So there's been times when there's been conversations about adding other things, and the pushback has been, well, it's not really germane to
Prescription drugs.
prescription drugs. So, so this fund, it's created in 2007. I think Senator Lyons was part of that. And
So I could interrupt.
Sure.
So this is essentially a tax on all prescription drugs,
it's,
not targeted.
it's not specific drugs, but it's a specific, it's based on specific drugs
Medicaid.
or spending by Medicaid. That's how it's calculated. But it's not on specific drugs. It's on, it's based on manufacturer label codes as used in the Medicaid rebate program. So it's those particular chunk of medication drugs that are, and this is, I think, how they were trying to define which drug to tax. And so it's the tax on the drugs that Medicaid includes in their spending program. And then,
For only Medicaid,
yes, the
who's
drugs,
getting taxed? Everyone?
it's the manufacturers,
Manufacturers.
all the manufacturers. So,
And then the other piece of it that we don't talk about a lot is that Medicaid does have a PBM that negotiates for lower prices, and Medicaid does really well with that. It's an amazing job.
but the tax is, you know,
Pretty,
yeah, it's based on,
I think it's on wholesale.
you know, you want to know more about it, I would invite Jen.
No.
Yeah, no, we don't need more about it. I'm getting right down the rabbit hole.
So it was created in 2007. The initial fee was 0.5%, and then it went up to 1.5 in 2016, and it was increased to 1.75 in 2019. And I have a little history of the revenues. So it basically in 2024, it's estimated to raise 4.7, and the estimated expenses are about 3.8. So there's an obligated balance currently of $5.2 million in that fund. And then this is a list of things that the health department has used or spent the money on each year. So this just gives you a sense of it, what the fund is currently used for.
Right.
Now, and then you have, don't question about this, but you go back to what the bill is now trying to do. Senator Weeks looks like
No, I'm reading.
formulation session.
This is posted.
It will
It
be.
will be, I,
Did we post it for, S98? I thought we had posted it. Possible. I mean, I know I have it for that report and for.
I mean, literally as soon as I stop sharing it, paste it. Senator Weeks, you're done looking at it all.
I have just out of curiosity, opioid antagonists.
I'm not the right person to ask.
Well, naloxone. Naloxone, yeah, naloxone. One of the reasons that this whole fund started was as a result of the whole overdose opioid over prescribing and overuse. And so it's a way of
I just sent it to you.
having revenue to detail physicians. That was the initial use, to provide educational programs for physicians. And right now we have a statewide drug detailing program. And there's I actually sit on the committee that oversees that. And we meet once a year, and it's an amazing group of people that now has achieved sort of national recognition because they go out and educate providers, medical providers, nurses and others about the appropriate treatment for overdose, for use of, opioids, OxyContin and others. And now it continues on with other, prescription drugs that may be problematic or diseases that are being treated. So it's a neat program that's established as a result of this fund. And then as we've looked at other uses for the fund that relate to prescription drugs, the list has grown. It's been a gradual process.
So this fund predates the opioid abatement fund? Is that why
Oh, yeah,
it's,
very much so, very much so. But and this is not time limited. This will go on. And the opioid abatement fund will last for what, 15, 18 years. So that's a fund that disappears over time, and it's unpredictable how much we get each year. That one is a result of a lawsuit that the attorney general, yeah, so I'm just trying, that's the context for both of those.
And this fund's been around since 2007.
Yeah,
So what the bill does is it proposes to increase the manufacturer fee. Did I just get kicked out? No, all right.
you took it off.
No, I got booted.
It's on our website. No,
It's on, yeah.
Yeah.
So anyway, it might be my computer. I got booted off yesterday.
So let's do this. Let's go to the whole, I'd like to go to the whole fiscal note for H72.
Also, I was trying to do.
Oh,
That's what was up.
Sure.
And then I got kicked off Zoom.
oh, you did, okay. So, because I think we'll come back. And as we look at the use of the fund in H72, I do have concerns about the application here and that for the, overdose protection sites. I'm not sure
I
that.
got kicked off Zoom for some reason,
Yes.
but I had the fiscal note up. I'm trying to get back in now. Been very weird. But you should have the fiscal note on your website. So
What happens when the house alert goes off, it's off, it's just off.
Is that true? I mean, are you just making that?
It makes it.
Oh, what? Yeah.
That's an April Fool's.
Oh, it's not April
It
yet.
said
Right, yeah.
something, it said something I didn't like, it said something I didn't like, so. It happened to me yesterday too, so. So anyway, you can follow along on your sheets or online, but basically like I said, the bill would increase that manufacturer fee from 1.75 to 2.25. And that would raise an additional $1.3 million that would go into the fund.
So my first curiosity there, I get that. The first curiosity there is why not just target the opioid abatement fund?
Well, that's exactly my question about this, and I think that,
So I can answer that. So for one, this existed before that too. There's things that we cover in here that aren't opioid related, and there's some stuff in the opioid fund that aren't manufactured.
This one.
Yeah, so and this is a question for Jen, but there were some things that, in the House, there was conversations about, oh, why don't we put this into the evidence fund? And Jen was not comfortable with that. She's like, well, that is different concern, different issue, less germane. So I would if you go down that avenue, I would, again, recommend you have Jen come in because she has some concerns. Like, for instance, there's conversations about paying for syringes out of this fund, and there were some concerns. Wow, that's so I think that the funds are kind of different, and stuff that's being paid for out of this fund has been, I think that have been consistent. We've added some stuff here and there, but it's just stuff that's predated the opioid fund.
yeah,
I just go on record as saying that. The opioid abatement fund seemed like it was tailor-made, but here we are, this evidence-based, et cetera, on new tax, with a raised tax. We know it's gonna be passed to customers.
so no, it's probably not, but let me just share with you that what you're doing right now is good. This is the discussion that we need to have when we go through the bill. So let's right now just understand what's there in the fiscal note. Then when we get to the bill, and you're raising concerns that I also have, but I think it's premature for us to discuss them at this point until we have further information from the Department of Health and the opioid advisory committee. And Jen and others, so we can really fully understand why we think the way we do on that particular section, so,
There's some differences between two
Yes.
funds
yes,
and the types of things you might want to use for each of them.
yes,
And Jen is really good at helping you
yes.
delineate between those.
We hear you, and I think there's a lot of thinking that will happen for one.
So, the bill would, amend the statute also, because in the, if you look at the, issue brief that lists all the things the fund can be used for, the bill adds a couple more uses to what that could be used for, including grants to overdose prevention centers. And so anyway, that's what you'll be discussing. You don't discuss it now.
I get you, no, you're right, but,
And then what it does is it add the overdose centers as an allowable use for the special fund. And then authorizes $2 million in fiscal year 25 from that fund to the health department for the purposes of awarding grants for 2 fixed sites for mobile overdose prevention centers.
Yeah.
So again, that's that policy that you will be discussing. So in short, it increases the amount in the fund. It adds a couple uses for what the fund can be used for, and then it appropriates new money to that new purpose. So I hope that, also, it's not, the last page, you'll see I list out the fiscal impact. So you have $2 million from the evidence fund for the new purposes, which are the 2 fixed sites or mobile overdose prevention centers. The bill also appropriates $300,000 from the opioid abatement special fund to contract with a researcher consulting to study overdose prevention center. That's the third
Yeah,
one.
yes. So a weird distribution, 90% of the cost comes from this education advertising fund, and 10% of the cost comes from the opioid abatement fund for an opioid abatement program. To me, and I'm not gonna want to dig in further, it's just very long head.
I'm not gonna let you.
Well,
But no, you're,
Yeah,
very
well, that's
good observation, and keep that,
Yeah,
keep that.
it will be interesting to figure
Yeah.
it out.
that's the policy you'll be discussing.
Exactly.
So,
It's a policy issue.
yeah.
Right.
So in short, $2 million from the evidence fund for the mobile, for grants, $300,000 to the health department for consulting researcher, and then an increase in the manufacturer fee of 1.3. So that's the fiscal.
It's a good note.
Is this a good note?
And,
Bill.
and so at the end of this note, I sort of talked about the evidence fund, and then I talked a little bit about the opioid abatement funds. So.
Okay, so the big discussion here is how this is all funded, if and when it is funded.
What's
And,
fun?
yeah, well,
Have fun.
yeah, so we have, so the first, the other parts of the bill are discussion on how overdose protection site is set up and where, and is it mobile or is it stationary, and is it near a hub, and all of those things that we have a lot there, and then how do municipalities make a determination that they may or may not want to do this. So there are a lot of policy decisions throughout the bill.
And one fiscal decision I actually meant to discuss was that the evidence-based fund has $5.2 million in unobligated.
Yes,
So I told this to the House and they saw that because there's $2 million appropriation out of that fund. And they said that their concern was that unobligated would kind of dwindle away and that there wouldn't be enough money to fund this going forward. So anyway, that was a policy decision that they decided they still wanted to do. So I just wanted to lay that out there that that without bias or opinion, that there's
Right.
enough money currently in the fund to fund the $2 million. I think that the question is the one-time or ongoing. So That's I'll leave it at that. Responses.
And we've obligated some of that, or we will, if and when S98 is passed, it's come out of the
That's right,
folks,
yeah.
it's on the floor.
That's true.
So we have that, that's, how much was that, total?
And then I will say that the caution that I received from AHS. That's like yes or no.
It's okay.
The thing that I was cautioned about. By the health department is. You know, the last couple of years, we look at, you'll see on the issue brief, on the revenues are coming. A lot higher than estimated, and their concern is that it's an anomaly. So if you
Yeah.
start increasing the cost and then it levels out,
Then it's
we'll
gonna,
have a concern, so. Their caution to me was like, hey, let's give it another year or two and see if the
Right.
revenues stay high or if they flux. So that's the caution as we think about S98 or this or whatever we're spending on the fund. Is it sustainable, is the revenue, and so I, when people have been wanting to spend money out of it, I've given them advice on a what each basis individually, so if you
Yeah.
do this, well, that might work, but if you do this and this, it might not, so. There's a lot of different moving pieces of things that want to be spent out of this fund, and that would all be settled. Down the hall. In terms of like tracking and asking you guys what the priorities are.
right, so with the two positions at the board and the, other monies,
So that's right.
that's theoretically it's one time, but
Well, half of this one time, it was two,
Yeah.
it was $495 and the
yeah,
positions were ongoing and the study and the consultant was one time.
right,
That's what it was.
Yeah. go ahead.
Can you help to articulate the linkage between S98 and H76?
Prescription drug cost.
I get that.
Yeah, right.
But the linkage between, what is it in 98, S98 that affects the advertising and education?
We paid, the bill paid for two positions or three positions.
S98.
And a one-time for the consultant to help them understand.
But I get all that.
That's
So
it.
they paid
What's
for it
that
out
to do
of
with
that
the
fund.
fund?
They used the fund to pay for it.
And so right now,
$495,000.
Yeah.
So that's what it was. Wasn't general fund, it was out of that fund. So that's the linkage.
right,
And then, this may not be in your charter, but I'm curious. The 2 million is requested. 2 million is, maybe 3 million is requested in here. For H72, is that, does fiscal office analyze whether that cost is correct or?
No, because it's
yes,
appropriation. It's basically saying, we want to give this much to them.
But it's, okay, but you don't do an analysis of, given the outline of the program, that this cost
It was
is correct
based,
or?
it was based on an ask, which is a policy decision.
that's something that as we take testimony, we'll have to hear about, why is it?
Yeah, I just didn't know if
Yeah, no,
Nolan and his crew.
that would be another,
They
that would
heard-
be a bigger,
They heard testimony and they said, okay, we want to give 2 million to this program,
yeah.
Who's they?
human services.
Okay, good.
So,
They'll
yeah.
create the same testimony.
Yeah, so we'll have to have Department of Health come in and we'll have to have others come in talking about both the fund and the ask that's in.
But I don't know if it's GEH's ask, I
Hmm?
don't know if it's the health department's ask.
No, Medicaid is Medicaid tax, but the Health Department has been engaged in the opioid settlement fund. I
Sure.
think.
I'm just
That-
saying, I don't know if the 2 million was their ask, I think it was advocacy.
No, it wasn't their
Oh,
ask.
okay.
No, No, that was, it was developed in the,
Yep.
in the committee itself.
Got it.
And from my understanding of that, it was, well, this is what we might need. Whether there was a full fiscal analysis that came in testimony. Go ahead.
Can you ask your question again, that you just asked in full? You said.
Oh, I was just wondering who the they was.
Yeah.
I wasn't
Your
there,
answer was, I didn't hear it.
I wasn't there, I wasn't in the room. for
We'll
most of
find
the
out.
testimony.
But you said house,
Oh, House Human Services,
Oh.
this bill came out of House Human Services.
Remember, Representative Small came in and presented the bill.
Yeah.
She's on that.
Okay, and so they, the members from that committee can come in and make their case.
Yeah.
I know this was.
It's
this was
probably in
important to
the-
them.
she left her floor report, it could be in there, but they also have testimony, and we'll have folks in
Yeah.
to testify on this. So your questions about the fund are good ones to ask. All right, anything else for Nolan? This has been really helpful, because I know one of the sticking points here, among others, but H72 is how's it funded, because if the pilot programs go in place. And then it becomes sustainable funding. Could become sustainable, it could be overtime, could be operations.
If we raise the prescription.
No, if the overdose prevention centers are going forward. The first year is a pilot in 2 parts of the state. So the pilot could be a one-time grant. However, if the pilot proves successful, with the structure and framework that we theoretically put in place, and then it goes ahead and it's successful, how will it continue? And then how will it be funded sustainably? So there'll have to be some funding for that over time. It is something that the state is asking to have happen. So it's not are there private organizations that are gonna come in and apply to do that, but seek a grant? Will it be something that Agency of Human Services takes over? How does that work? So there are a lot of questions embedded in the funding piece itself. And once you obligate a fund, then it will go on, and then embedded in that, say, mobile crisis, mobile unit, overdose prevention unit. There are salaries and benefits and all of those things that need to be considered going forward. So the steps we take now might be critically important to how this could theoretically be funded going forward. So the questions you're asking about the fund are really important. And that includes the opioid settlement dollars. So, there are different ways of doing it, and we'll have to hear from folks involved. And so, okay, any other questions for Nolan? So you just raised all these things out there for us. Good policy decisions that we have to make. All right, thank you. All right, so we have a little bit of time, and well, it's not on the agenda. I thought we might ask Senator Weeks if he's prepared to talk with us about appointments. Does anybody not want to do that?
I was kind of hoping to go to the big announcement upstairs at 10:00.
What is it?
I can finish before that.
Okay,
It'll
great.
take like 2.
Big house.
I'm chair of education.
Oh, didn't know that. Well, you guys, yeah.
Yeah, and maybe all 3 of us should go.
So what do you have?
So we have 8 governor nominations for health and welfare related positions. They're all, so far, all 8 are for the Board of Medical Practice. So what I've included here, it's in the center of this matrix, is the names, the residents, the town they live in, whether they're a public member or a doctor, a medical member. So first pass is, are there any folks on here that you know or you would prefer to contact? Because you know them personally, they can make the contact simple.
Nope.
If not, I'll randomly just based on geography
Okay.
and go from there, unless you have different.
So I talked to Dawn Filbert last year. I'm just trying to remember. Thought she was trying to move off the board. So if I have her contact information, I'm happy to give her a call.
Yeah. This is the contact information. Thank you, Kiki. Appreciate that.
Excellent. And why don't I also do the South Burlington medical practice person?
Margaret,
And
And on here, yes. So this guy.
Any others have a preference?
I don't know anyone and I'm not geographically close to any of them, so. And I mean, Ginny just took the ones that I would be
Do you
geographically.
wanna do them instead?
No, you go for it.
It's really a matter of, I think, correct me if I'm wrong, we asked them what if they're current members, if being reappointed, do they have an interest in continuing or being?
Same drill as us.
Same drill.
Shouldn't we know that? I mean, doesn't somebody know that already, if they're actually on the board and serving? Because a couple of people I contacted last year said, yeah, I'm already on. Well, that's because last year there was a huge latency over a year. People were, and you'll see it on the letters, for example. Dawn. She started, actually, all these folks started on January 1. The nominations for, in fact, January 1, 2024. So you'll have that information, whether they were previously a member, don't, okay. Can ask governor's office.
And we know the term of their,
And the term is on here as well. I'm not gonna, I wanna pass through the full package, I'll just pass you both persons.
all right, I'm just saying, give me.
I don't
whatever-
need to do any. exclusive.
No, you don't, but you won't.
So Senator Weeks already has Rick Hildebrand,
I did, just because I'm,
okay, and, just, how many have you got left? 1, 2, 3, 4,
Hey, we can give them all to Ruth, cause she's not.
2, 3, 4, 5. So we have 2 people doing 2 and 1 person doing 1. So we can assign Senator Hardy.
okay.
She's a chair, give her 1.
Okay, I'll give her,
Who do you want, Martine? Who do you want? Jerry.
I'll take Judith Scott.
Who?
Judith Scott of St. George,
Oh, yeah,
even though she's your
that's
constituent.
good. Yeah, no.
I'll take the total, Dr. Robert, Total Lammy.
Oh, for a while. Yes.
take, Dr. Evan Island.
Okay.
I'll get one of these.
You will, let me just, because that's the way, somebody, I'll scan.
Okay.
So who's left?
So Ruth, we give Ruth, David Coder. There,
Where's that?
5.
I thought Gulick has the other one, St. George.
Yeah. And I'll give her number 7.
Good.
Okay, then I'll summarize this, give you the contact info again, give you a scan of the letter. So, okay,
So we have the contact information. The letter indicates whether they've been appointed already.
they all have, so they all have a start date of January.
Okay, so they've been on there since January 24.
Can you give us like a suspense date, because I react a lot better to it.
3 weeks.
3 weeks?
What do you think?
Yeah, yeah. Good.
Let's do it tomorrow.
Huh?
Do it tomorrow during a snow day.
I'll be shoveling.
Well, so how about April 5? For the first.
Come on.
Keep you motivated.
I mean,
April 5th. I need
There
all
will be
the
more, so my recommendation is let's pass this through.
I just, from my personal experience last year, when I called people, they were taken aback, and
Yeah.
kind of almost annoyed.
I agree.
Here's my suggestion.
I wish I
Send
had
it,
an email.
send an email.
I don't have an email address for her.
Oh. Call her and leave her a message and say that this is the usual,
Okay,
the process for confirmation of their appointment and so if you'll, because, yeah, according to statute.
I got the impression that they weren't irritated, but they were surprised that we were actually contacting them. Because some of these folks had gone back 10, 15 years on these boards and they had never been contacted by legislators.
at least one person was irritated.
Okay,
which made me feel weird, like.
But it's that you shouldn't, then you have an opportunity to educate.
Right.
Yeah,
It's actually, it's our obligation.
It is.
yeah,
I had one too, and it was how you respond to it,
Okay.
because she called me back afterwards and apologized.
Oh, okay.
I said, just trying to do what I'm been asked to do.
Right, exactly.
well, and some of it is, I think, out of our responsibility when, they should be told that part of the process is approval through the Senate.
Mhm.
I don't think they're told that. That's maybe something we can talk about, maybe, let the governor's office know that it's helpful for that. We don't like upsetting people in any way.
So if there was like a position description somewhere we could get for what board members of the medical practice board do, that way I could have a conversation with them based on all.
So you could look it up in the statutes.
Okay.
Could ask. I will,
You'll find the majority of these groups online as well.
Yeah.
See, they've got their missions.
oh yeah, just go to the Board of Medical Practice. We did it.
I saw, I passed Nolan,
Oh, yeah.
right, so
Did you want to talk with us?
if you need me, but otherwise I actually have plenty of other things I could be
I
doing.
think that would be good, and we had a really good conversation regarding the funding piece.
Mhm.
You know, the manufacturer's fee fund and the opioid settlement fund for supporting what's in the bill, so we can come back to that, we're good.
Okay, all right, well, please reach out if you've got any questions or I can help you with any materials.
It's nice to see you.
Yeah, nice to see you.
Thank you for being here.
So,
Michelle, since you're here, there is no amendment on S-114, correct? We're all set?
you're all set, it was just sometimes when, cause.
So before you go there, are we finished here with this?
Well, I just wanted to say that I would anticipate that the reason why the governor's office doesn't tell these people that the Senate will contact them is because they don't contact them.
Well, what I would say
So
is that
see-
part of the process is that the committee of jurisdiction, whichever it is, may contact you for confirmation. Some committees don't do this at all, and then because they feel, oh, we have the information. Our committee has tried to do that consistently. I think we've done it for the past several years. So some of the information that we haven't received about contact has been, we haven't gotten everything we need, so now we have it. So it's been a good process to lift this up, because I think it is important to do that. Okay. So, all right, let's go off live, because we're gonna call it a wrap, and then